Good afternoon, everyone. Welcome to the seminar that's organized by Nelson Mandela Center, Hans Seidel Foundation, and we are pleased to welcome you to this very important seminar related to health policies and the Thai-Myanmar uh, border health issues. At this point, I'd like to also welcome the participants online. And I'd like to give now the floor to Mr. Aki Moons for his welcome and opening remarks. Please.
Thank you, Professor Noel. As noted by Professor Noel, this is one of our joint lecture series between the Nelson Mandela Center, the Chulalongkorn University, and of course the Hans Seidel Foundation. We're very happy to have this lecture series on border issues along the Thailand and Myanmar border. And this is also part of a wider project that we have together with the Nelson Mandela Center that supports Myanmar students in Thailand, but also provides an academic exchange between Myanmar students, researchers, professors, and of course, researchers, professors from Thailand. And this is what we do in a wider scope, beyond the Nelson Mandela Center, beyond the Chulalongkorn University, and of course also with cooperations with the Chiang Mai University, I should note here as well, providing scholarships, research opportunities, colloquias between the students presenting their work. I think some of you have also been last weekend perhaps also at the Burma Studies Conference. And of course, some of the people that we have supported could also showcase their work there at the study conference. And I know Khathaleeya was also, of course, there, Noel too. So it's very good to have also today this topic on protecting health beyond the borders. And I think it's very timely saying this also beyond the borders, because the health issues, of course, that have been coming through the coup and the conflict in Myanmar is not only along the borders. Yes, it moves into Thailand as well. But all of you may have recently also noted that one in the news now. There's a significant cholera issue in Yangon. And this is part of what the conflict, of course, has caused. This is part of the system, of course, you know what I mean, that is detrimental in the country. The health system that the junta is managing is collapsing. This is a clear sign of a health collapse. If you have cholera in a country that has no natural disasters at the moment, yeah, that has come through normal, so to say, changes of weather with the monsoon coming, and of course has a huge impact now in a huge city like Yangon, yeah. And this is also what we then can only imagine what is of course going on in parts of this country that does not have a health system as such at all, yeah. Yangon, I should note, has probably one of the best healthcare systems in the country. And so we can only imagine what other parts of the country are suffering. There have been, of course, huge issues in terms of vaccine shortage, or basically no supply to shortage. So the border areas, in my opinion, have become more and more important, especially, of course, the Thai border to Myanmar, to provide support, supply, but also, of course, to prevent the spread of disease into Thailand. And I'm very happy, Ajahn, that we have today you talking about this issue, because I do think this is a issue of national security as well for Thailand, and of very much importance in this dialogue that we have at the moment between Thailand and Myanmar. And that should be highlighted as well. That goes beyond humanitarian issues, and of course, you know what I mean, has a huge impact. So, Ajahn, thank you so much for giving us your time and presenting on this very important topic.
Thank you very much, Akim. I'd like to introduce now Dr. Khathaleeya Liamdee. She's a lecturer, the Department of Sociology and Anthropology, and also the Deputy Director of Politics and Global Studies at oh, okay. International Undergraduate Program of the Faculty of Political Science here at Chulalongkorn University. Previously, she worked as a researcher at the Mekong Study Center, Institute of Asian Studies, focusing on Cambodia and border studies. She holds a PhD in anthropology from the University of Washington in 2020. Her research interests cover both non traditional issues of cross border security, ranging from studies of Cold War specialized in mainland Southeast Asia and studies of transnational organized crime and border healthcare between Thailand and neighboring countries, including Cambodia, Laos, and Myanmar. So I'd like now to give the floor to Khathaleeya for her presentation.
Thank you so much, Noel. And thank you, Akim, for the introduction as well. And also, I would like to express gratitude for Han Seidel Foundation and also Nelson Mandela Center for inviting me to talk about the issue of the border health today with the public seminar on Thailand and Myanmar border health policy, protecting health beyond borders, evident partnership and humanity for a more resilient future. So, as Noel just introduced me, so I'm anthropologist by training, actually starting from just border studies, and I graduated during the COVID time. So that was the point of entry to just thinking about health in terms of like it's our impact, our life, all of us here. And recently, I also published the work that actually built it during that time on the comparative study about the pandemic preparedness and border management in Southeast Asia, especially Thailand, Cambodia, and Myanmar, with the ideas of using the concept of human security and biosecurity that we could think about health security. And Ajahn Panupat was the one who invited me to join the issue of the Thai-Myanmar border. So that's why I get used to the area of this topic as well, beyond just Thailand and Cambodia as my original interest. And here, this is like back to the COVID time, and this is something that we could also think about, like how Thailand was thinking about the border surveillance in relation to health at that time, and it's intersecting with the time that after the coup, just 2 months after the coup happened in February 2021, and there's some kind of the infectants trying to do something at the border, which is something that it's become my question, like how we could think of the health security in terms of the Thailand and Myanmar borders. And for today, I will focusing on the research findings from this project, which is a long name, long title, Health Humanitarian Assistance and Health Security along Thai-Myanmar border, landscaping healthcare needs and stakeholder perception towards the national health border health policy development. So this is actually, we just wrap up the project in June. And as Aki mentioned, we just presented this this research at the ICBMS Burma study in Chiang Mai just last week. So if anyone's already there, it will be pretty similar, but it's a longer version. Today, we have a 1 hour, right? So this is our, the name on the screen is our team members. So I be the one representing for today. And the research was supported by Health System Research Institute, or SHRI, of Thailand, Ministry of Public Health. And the objective of this work is trying to understand the border health situation and also the role of the stakeholders along the Thai-Myanmar border, which is trying to understand the unit situation, the public health needs, including medical and public health system service system that available for the population on both Myanmar and Thailand side, and trying to find way to establish a collaborative network among researcher, academics, policymaker in Thailand public health sector. So we had a lot of chance to meet with a lot of policymakers, and also this work is really interdisciplinary in its own way, because me as an anthropologist and working with the medical doctors and also other public health sector that come up with this policy recommendation for people at the border, by trying to develop the effective border health policy draft, which is we also have few copies in front of the room that you can grab uh, to read it as well. So developing from the research finding here by really focusing on the health security and human security and humanitarian assistance. And here, this is like because this research are proposed by the National Health Foundation. So when I first talk and agree to do the work with them, they also already have some idea in mind, and they already been in the field trying to navigate what kind of needs that and in any aspect that they would like to delve into during the research field work. As you can see from here, they're trying to visualize from two sides, both inside Myanmar and also in Thailand, and also along the border, which is we will primarily focus on the Thailand side. And here is our methodology and timeline. So in the period of almost a year that we have been doing, is actually originating in this room. We have the first meeting, first focus group in here in this room as well, trying to talk to people at the central region and scanning the issue, that how, rather whether we see the similar point of concern or not, or no. And then we went to Chiang Mai for meeting with the hospitals and public health officer in northern region, not just in Chiang Mai as well. And then we went to Tak and Mae Hong Son province, and after the field work, we have validation meetings with the legal experts and also the policymaker to validate our findings. And we also have a dissemination meeting here in this room as well. So this room is really important to our research project. And yes, we do both focus group or key informant interviews, and also there's a policy dialogue. And 2 weeks ago, I also just went to the parliament to propose our policy recommendation to the MP of Thailand as well. And this is our conceptual framework that become our main focus, as you seen it before, that not just about the health security risks that we are going to focus, but it's also the humanitarian health needs that we would like to find a way to balance of these two, because with the Thai-Myanmar border situation, there's a lot of the humanitarian needs, which is include the health sector as well, not just about the displacement, about the education, or the other issue. And here a little bit on the conceptual framework, as I mentioned that I'm anthropologist by training with the medical anthropological perspective of it. So the way that I approach this work, I have to think about the social determinants of health, that how it plays with where people live and situated within the Thai-Myanmar border situation, and also the social suffering that become a structural violence that create the health disparity regarding with the Thai-Myanmar border, not just the immigrants, but it's also relating to the citizenship and all the conflict situation along the border as well. So here, this is more conceptual framework that we use, as I mentioned. The health security is, of course, it's a security first approach, and it's including with the biosecurity risks, that how we gonna do a risk control along the border. For the Thailand National Security Council, they also have the Border Management Security Action Plan, which is actually also including the health security, health risks into their action plan, as well as we experience the COVID time. That's why it's become important for the security sector. So the health security part, they do about the migration control, screening, interception, and communicable disease surveillance to prevent the cross-border transmission into inner area by following the guidelines from the International Health Regulations Framework, and also operationalized through the Public Health Emergency and International Concern, or PHEIC mechanism for the disease surveillance. People from the Ministry of Public Health, they try really hard on doing a proactive and preventive care, more like upstream prevention, in order to see the health security more like a regional perspective, not just within the country itself. And it's also aligned with the humanitarian assistance, which is a human rights-based approach. You can see the not a contradiction, but it can be all going together in the way that this way we could do an operating within the human rights framework and also cross-border care. So if the health security is a risk control, the humanitarian assistance are about the cross-border care and control altogether. And the right to health is also very important in this part, because it's not just about the migrants, it is also war refugee, displaced person that become a vulnerable people, that they are also entitled to be protected, and also make sure that they should have provide a equitable access to basic public health services without any discrimination, regardless of their nationality or legal status. And the Ministry of Foreign Affairs also have a policy on the border health cooperation as well, which is called in Thai, it called ช่วยเขาช่วยเรา, or in English, helping them is helping us, because they also acknowledging that if they have a stronger facilitation for health services, it also not to become burden for Thailand public health as well. So after the coup, there's a few major healthcare services that they are taking care of, about the trauma care, the war casualty management, the maternal and child health, for example, and also disease prevention and immunization, which is really important for both Ministry of Public Health and Ministry of Foreign Affairs. And here's the dual mandate for a border health issue that, as I mentioned, they're trying to find balance between these two, health security and humanitarian assistance, as the transitioning towards the ideas of the comprehensive security. So this is the term from National Security Council that, as I mentioned, that they acknowledge the health security as part of other ideas of security related issue as well, not just about a traditional one. And finding way to advancing the right to health alongside with the right to work, as other panel, other public lecture probably talking a lot about the right to work already after the funding cut to the border camps. And this research also trying to find the legal mechanism that maintain an adequate levels of protection, reduce health security risks, and also alleviate the burden of the healthcare workers along the border as well, especially the Thai border hospital. The key concern is more on the structural level challenges because we experiencing the global funding cuts, the aid transition, like how we acknowledge the hospital burden, both the operational and also a financial burden as well. สวัสดีค่ะ and the debate around the formalizing informal relationship into the official coordination. So I will a little bit on talk on this because that doesn't mean, even though there's a unclear relation across the border between the ethnic groups and also the Thai public health sectors, but they have been find way to do informal collaboration very long time. It's there's a debate whether it has to have to like formalization or no, or just keep it low key, as just informal as much as they can. And the thing about the camps, there's a plans for permanent closure for the displacement camp. So it will be something that we can talk about further, especially about the workforce and financial burdens to the Thai public health sector as well. And the protracted political crisis also implication to Thai and Myanmar bilateral relation, as well as I will show you in the following slides, and also about the Thai public opinion, especially those are from very ultra nationalists that going against to healthcare provide the healthcare service provision. And here we're getting into more details on the health landscape in the Thai-Myanmar border areas. We had a chance to went to Tak and Mae Hong Son and Chiang Mai, but I mean you can see from the maps that the borders are long, and each location have a different health context to it. You can also have to think about the geographical landscape that also have an impact on the way that the health services are provided as well. So here are the Myanmar health system pre-COVID time and pre-2021 coup situation. So before all this, there's a poverty also become a limit access. The poverty limits the access to the healthcare. There's already the health disparity across the country, and the conflicts is what has been before the coup, obviously. So the prolonged conflict and human rights abuse also cause more mortality and mobility rates inside Myanmar already. So, so the infectious disease that become has been a point of concern for a really long time is malaria, TB, and HIV, and mostly people are rely on the ethnic-based organization rather than the central public health system. And what happened during the COVID to the border health in that part, it's when there's a strict border control, so it's drastically reduced cross-border mobility, meaning that it's unable to proceed the referral system across the border, and also transportation of pharmaceutical production and equipment, and also a public opinion on the government response to the COVID-19. I think it's also happened in both Myanmar and also Thailand as well. For example, COVID become politicized to use as a political tool, and it's also there's a more visible acts of the xenophobia because like they would see foreigner as the source of the disease or something like that as well. And it's the situation in Myanmar is more like a epidemic of human rights abuse in Myanmar, which is the armed conflict and human rights violation as a social determinants of health that I mentioned at the beginning, because it's created more high rates of infants, child mortality, morbidity, and also malnutrition. In the conflict zone, it caused epidemiologic blind spot, which is creating more preventable deaths in more hotspot of the infectious disease, and it's also posing the domestic international health security threat, which is, for example, the return of malaria to Thailand. Because actually, for the Ministry of Public Health, they actually would like to declare malaria eradication program, which should end in 2024. We 2 years later, but we'll still see the higher number of the malaria case along the border, and it could be entering in inner area as well because of the situation. And here's the this is the graphic that we received during the field work long before this research project, but they kind of trying to talk about the health system, health management after the coup. And because of the Thai-Myanmar border as a become a conflict-affected humanitarian borderlands, so mostly people on the Myanmar side are relying on the ethnic health organization under the ethnic resistance organization as well. So since 2021, there's over 3 million people have been internally displaced, and also giving more a influx of the migrants from Myanmar into Thailand as well. And here's the impacts of the 2021 coup on the border health. Of course, Akim already mentioned about the collapse of the healthcare system inside Myanmar. There's an unsafe working condition for health workers in Myanmar. The CDM health professional who work in the conflict zone being threatened, arrested, and killed. And clinics and hospital are being targeted by the SAC, especially the airstrike, the drone attacks. And also the SACs fail to cooperate with the ethnic health organization as it's supposed to become better during the civilian government because as I mentioned that people rely more on the ethnic health organization, and actually for the central system, they actually see Thailand as a model to develop the central health organization, health system, but it's become stopped because of the coup. And it's the rising cases of the injured soldier and civilian in the Thai hospital because there's no place to taking care of. That's how it affects the hospital bills. So mostly usually used to cover by the ICRC and IRC, and we know that I'm going to mention next about the funding cuts that also affect this coverage, and also the operation of ethnic based clinic along the border as well. So they're getting more receiving patients, and also emerging of infectious disease that I mentioned, not just about the disease itself, but it's also about the drug resistant cases that will be really concerning because of we cannot transporting the medicines inside Myanmar, and it will cause this very troubling issue. And this is like at the beginning of the coup, right? So there's people trying to build the revolutionary hospital in the forest, and there's a case of the malaria case on the Thai border as well. And here's a statistic from the insecurity inside from I think they have they're providing the dashboard, and this is from the recent report, I think ranging from 2021 to 2025. And this is a quote from their website. Why is the military attacking health workers? The reason is ultimately both simple and shows a grim reality that a healthy population is a resistant population to the military rule. So you can see how the health perspective is really important for all of us here. Oh, you want to take a photo? Okay. So this is not my quote. This is from the website. Okay. Okay. And one more issue I would like to add here, we don't really talk much about, but I feel like we can talk about the environmental issue, but at the same time, we can also adding this environmental issue to a health issue as well as we know that the trans boundary haze or PM 2.5 also really impact us all to Bangkok as well, right? So because there's a lot of the contract farming, but it's also, you know, with the land dispute, the expansion of the scam compounds, it's also need lands to do something like this is also could be part of this environmental issue as well. And the more recent and most discussed issue nowadays during this time, it's about the polluted water, right? It's not just about the deforestation, but it's also the mining industry. And that picture from, you can guess, from Mesai area, right? And there's the issue of the river channel blockage that's caused by the construction at the river banks as well, and it's also related to the mining industry as well, and we could take it as a health issue as well. So here we move a little bit inside Thailand for the Thailand's border health situation, and I would like to highlight it as the health disparity issue. Not necessarily just recent coup, but it's also, I mean, it's been long discussion about the access to healthcare, because along the Thai-Myanmar border, the access to healthcare has a logistical challenges. There's a hard to reach areas because a lot of like a mountainous area, and also poor infrastructure for public transportation. For example, we also went to Ma Sam Lap, which is a Masariang province. So during the rainy season, the road is very, very dangerous. So it's really hard for transportation across this region. And the issue of the rights to healthcare access, of course, Thailand has a universal healthcare coverage or USC, but even it's called universal healthcare coverage, but it does not include stateless border dwellers and also any non-Thai citizen, right? It's unregistered and also the unregistered migrant worker, both in agricultural and industrial sector. And about the financial burden for both hospital and patients, because you know, in other border area of Thailand, for example, Laos and Cambodia, so they actually really promote a cross-border health tourism because it's generate income for the hospital. But for the case of the Thai-Myanmar borders, there's an issue of like there's a people who resign along the border have no money to pay the bill for the hospital. So it's not just when people talking about this issue, they mostly like to talk about the financial burden to the hospital, but at the same time, it's because of some patients also has no money to pay as well. So there's trying to find way to cover this unpaid bill with the health insurance, which I also will share with you later on. And here's as a classification of the border population groups. I did it since my very first research on border health. So it's actually ideas from Cambodian side, but I think it's really fit in all other border area as well. So for the Thai people, if they hold a national identification card, they will receive fully covered by the universal health care coverage. But if they're stateless, even they excluded, but Thailand trying to provide through other scheme, which is called the stateless insurance coverage. And if there might be some non-Thai but mixed status family, but maybe married to Thai citizen. So they might rely on their children who born in Thailand and receive Thai citizenship or something like that. But they're still excluded from the health coverage. For the migrant workers, so if they're getting into the system, they will be covered by the Social Security benefits. And temporary visitor, which is also include other non-Thai that don't have any secure job or work permit on that. So they supposed to pay fully to the local hospital, and that's how Thailand also promote the health tourism, medical tourism, because they could find the benefits from here. But at the same time, not everyone can pay in full as well. And here, so this is not my slides. I just would like to this from the Ministry of Public Health. So they show about the health insurance in Thailand, which is in the red box. You will see that the Ministry of Public Health trying to find way to provide the health insurance for the migrant worker, which is called MHIS. But as far as I know, not really successful that cover all, because it has to be registered through the system as well, but not all of the migrant workers could do that. And also the health insurance stateless people. So this one, as I mentioned, that they also trying to cover to the stateless people as well. And the social security scheme that also the migrant worker that have a Thai employers, they would apply the social security scheme for the migrant worker in this one as well. And here's not my slides as well, but I think it's really see the overall picture of the models of the health insurance in Thailand that you will see they're trying to cover, ranging from universal health care to just the cash, right? And so here, this is the issue that, as you can see, that some of the hospital also relying on the funding from the international aid. But when there's funding cuts, it's also really impact the border health system along the Thai-Myanmar border. And the picture in Thai, there's a case of the medical doctors in Masot. It also becoming crisis because it's overwork, and they just quit because that they cannot bear it anymore. So it is too burden for them. So here I would like to more clear in classification of the non-Thai, expanding from the previous table that I provided to you. So the non-Thai health insurance and coverage scheme here, as you can see, this is the post-coup situation, right? So long before that, there's the ordinary cross-border patients that they have high chance to have no cash to pay the bill in full. And migrant workers already have the migrant health insurance, and also the M Fund. This is another scheme that the NGO trying to propose that and selling to migrant worker to be covered. But recently we have a discussion and seeing that these, even we trying to provide this kind of insurance, but the maximum capacity, the money that they could get reimbursed from the insurance often not enough to cover. So that's why there's a certain debt left to the hospital as well. And the third group, it's a newcomer, well, 5 years already, it's after the coup. So we got both patients and also the CDM health professionals that in our research to also highlight the issue of the health professional here as well as the potential workforce for the Thai-Myanmar border as well. And the next one is about the displaced person in the camps. Yes, as I mentioned, it's about when the funding cuts and the plan to camp closure, meaning that how we can support the right to work and right to health at the same time. And when there's no funding inside the camp, the new burdens come to the border hospital. So how we could find way to support the border hospital that getting a new kind of assignments into this one. And the last one is about the injured soldier and civilian due to the armed attack. So most of the armed attack, the injured soldier need longer stays in the hospital and in the patient's house, and of course the payment coverage that used to cover by the NGO IOs experience the funding cuts, and how this is how we have to figure out all the financial perspective for the border hospital and the public health as a whole. And this is Dr. Cynthia, just her dedication to the health services is also focusing a lot on the patients, that it's not just the migrants, it's also people. And I think her quote here, it's quite important on the gender perspective that we should think about as well. That's why in other slides, I also mentioned as child maternal care as well. That is also important. And here, this is not an advertisement, but the organization that has been helping on the financial coverage, and you can see the M Fund plan here, that trying to encourage all of the non-Thai population to buy the M Fund, and for the injured or long stay patients or child patients also has been got assist by this group organization as well. And here, let's get into more our details on the how we found during our research field work. So this is the stakeholder mapping that got inspired by the Masot hospitals, that the way that they have been coordinating across the border, part of their mission is that they do a stakeholder mapping from time to time in order to update the people that working with them. So here you can see that it's also kind of visualize both sides, I mean Myanmar side and Thai side, to see the situation and to see the interface or the border area, how they have been coordinated to one another. And as you can see with the Myanmar situation, that there's a clash between ethnic groups and the government. That's why there's a lot of vulnerable population that the ethnic health organization has to taking care of. So both just the migrants and also the wounded refugee. And for the Thai side, we can range from the central policy agency, central government, and also the security agency, that how the both sides can coordinate it, and from the ministerial level to the provincial level. So each province would have a provincial public health office, and for Masot, they also have a joint information coordination center, which is stay with the border health learning centers as well. And they're also working closely with the border district hospital, which is more like a secondary care before the most likely to be the final stop as a regional or center hospital, for example, in Chiang Mai, something like that. And as you can see, the work that they do along the border, right? It's ranging from the health diplomacy, from the Ministry of Foreign Affairs, and also going through the semi-formal coordination. For example, the border clinic, which is like the first stop as a primary care within the camps, patient's house, and all the CSO work. And they also established the parallel healthcare networks and twin hospital. The word twins also quite important at the ministerial level as well, because they can see this 5 way to build a formal network. But sometimes it's also in the village unit level as well. It can be twin village corporation, not just a hospital. So the work that they have done is about the disease outbreak alert. They do a cross-border provision of vaccine and medical supplies, and also the patient referral system, which is, I think they actually establish a solid coordination, but at the same time, as I mentioned, it's remain informal. It's not an informal one. And I couldn't read it that much, but it's more like a details on because the font is really thin here, but I hope you can read it on your own. Sorry about that. But yeah, there's a more like work on this the cross-border cooperation here, which is aligned with the humanitarian assistance and health security at the same time. As you can see that we can see both sides here. So here, the last part of my presentation is about the policy recommendation. So it's more like really a goal to this project that we would like to explore on a health workforce and also the capacity building for the workforce along the border, and also see the ideas of the cross-border logistic and referral system. And the last issue is about the health financing, which is you probably see that it's also the serious matter here. So actually, most of the policy recommendation here came from the success story along the border. It's not that we get a really innovative recommendation or anything, but it's actually we would like to be a mediator to bring the story from the border to the central region, because most of the time people at the center not really had a chance to visit the border. So this is something that really important to see how people at the border are really resilient and really proactive in doing this work. Here's the health workforce issue and the capacity building. We are very proud of these 4 years because we got it during the validation meeting, that realizing that as I mentioned, that the border hospital are experiencing with like the workforce and also the financial part of it. And as I mentioned, that there's a lot of CDM health professional that already came into Thailand, and their ability to work has not been really promoting or getting support to the border hospital. So with the regards of the work permit issue, it's quite challenging for all of them to work in Thai legally because of the bureaucratic part of the Thai system. So when we do this, we divided into 4-tier classification, that allowing to figure out that how the health professional can get into the work. So the tier 1, it's about the health volunteer, which is already there in the field. It's called OSOTO, or my foreign migrant health volunteer. And it can also work through the Thailand National Red Cross as well. For the second tier, it's about the medical assistant and medical coordinator. The third tier would be the clinical staff, and with their really strict supervision, which is something that we aim that it could happen more, meaning that it's already happening along the border. That's why we came into here. And the tier 4 is it's the most difficult one because you need to get a license from the Thailand Medical Council, which is you just have to speak Thai, and pass the exam that written in Thai. That's the hardest part, but not, I mean, if there's anyone would do it, he can do it as well. So from this classification, we see that we can also propose the conditional temporary licensing for these health professional to work on tier 2 or tier 3. And one thing that they could do that is also about the practical certificate for the quality of care, which is not just working on the Thai side, but it also way to work inside Myanmar again as well. Because one of the thing for the body health situation long before, a lot of patients or population across the border really do believe in the good quality of Thai doctors along the border. That's why it's become popularized in the way. But if we could provide some certain sort of like a certificate that also bring back to Myanmar in this part is also a good channel to do it as well. And we could also do about the standardize of the training curriculums and also contextualize the training and system orientation in each location of the border. As I mentioned, it's slightly, even though there's a lot of attempts to use the method models to other border regions, but at the same time, there's a different context that method would not fit in certain context as well. So that's why it needs to be contextualized in that part. And this one is also important. Actually, doing a training, all this stuff that is also help building social capital through to a long-term capacity building through the work professional, both Thai and Myanmar doctors, and also have built a close connection when they're doing sort of a referral system or logistic stuff. When they know each other, it would really help on doing a preventive care across the border here. And this is more detail. How much we have time left still? Really? Okay. The medical licensing part, as I already mentioned, that the strength, if we can do this, but of course we are also, for the Thai side, they are actually concerned about the professional standard and the quality of care, and also the medical liability, that how much they could rely on this kind of temporary licensing as well. And here's a success story. As I mentioned, Masot Hospital already have a friendly clinic model that they have employed the Myanmar physician to help working at the OPD. And it's actually really reduced waiting time for the Thai patients as well. And it already proved that it's worked. And the second one is about the medical coordination model, which is from Tha Song Yang Hospital, that they got to taking care of the health services inside the camp. That's why they need to hire some medical coordinator within the camp. It's more like a Tha Song Yang Mela branch or something like that. Okay, and here's a picture. And actually, we also had a chance to talk to the Ministry of Labor. So we got recommending that if you want to do a tier 2 or tier 3, you have to talk to the Thailand Professional Qualification Institute, which is a public organization that could see the qualification that, like, if the border hospital would like to hire certain group of people, you need to get qualified. If not the Thailand Medical Council for the tier 4, tier 2 and tier 3, you need to trying to see the qualification through this institute. And this is the logistic and referral part. So there would be upgrading because Ajahn Sirada already mentioned this issue in the Myanmar study conference, that actually these kind of cooperation are really area of like a highly potential cooperation across the border, even though there's still the conflict ongoing. But with this part, if it could make it worse, it also help Thailand for the disease surveillance as well, and they could do through the information sharing system. And here, maybe I would like to skip, but the logistic part, the cold chain, the supply chain, that as we mentioned, because of there's a lot of stakeholder involving, and it's quite challenging to transport the supply. So if there's a way to provide pathway to get into Myanmar, it would also help in the preventive care a lot. And here's the cold chain room along the border on the Thai side. And this is also another success story, because as again in Masot, they have Matao clinic, right? And they also have like system that helping care for maternal care here with the Matao clinic, Masot hospital, and also the SMRU, also Malaria research unit here as well. And already mentioned about the twin village model, and also trying to be more a systemic local level patient referral planning. For example, in Masariang, they already have a plan for a transfer, especially the emergency transfer for those who get injured from the armed attack here. And this is a patient house. And this is also about the disease prevention success story method again. So because they already have a close relation with the people on the Myanmar side, so they actually success in cholera control in Tak province, because they got alert before it got spreads. Okay, so and also another system is about the biometric, which is something that they could have. This is quite challenging because it's about the security, the PDA, all the stuff there. But at the same time, when they can register in this part, they can also tracking the bills that it got paid or not. And this is a help financing part. I think you probably see the ideas why financial burdens become the main topic, because the way that the Ministry of Public Health are providing the healthcare coverage, they only cover Thai citizens, so they not cover non-Thai. So the issue, the burden become to the border hospital need to find the financial support on their own. So this is our recommendation. We're trying to do the systemic fundraising, or maybe resource pooling, or even with like what is called a border health fund that providing to the hospital along the border. This is our policy recommendation. You could grab in front of the room for further details. And the final one, sorry, you want to take more? That's okay. The last one, the points of concern. Again, I actually already mentioned about the ultra-nationalist group that attack the Thai hospital that provide services to non-Thai or migrant worker. And because they believe that the excessive debts stem from the unpaid bills, suspecting that the budget that provided for the universal healthcare coverage were allocated to cover this debt. And also the chief of the direction that they actually aware that maybe we should no longer depending on the international aid, but more self-reliant. So how we could think about the border hospital that receive this burden instead of the funding going to the camps or something like that. So it's also the tax for the both workforce and finance. And the last one is about the cross-border collaboration, whether it should remain informal to avoid politically sensitive issue with the government, or there's still a challenge to do the formalization in this part. And here's actually the heartwarming story from the Umpang Hospital in Tak province as well, because of the situation, the hospital experiencing the high rates of death, right? And they actually asked for a donation. So there's a lot of people donating to Umpang Hospital, and a lot of group from Myanmar actually trying to collect the money to help to donate to the hospital as well. So that's how the border population also being resilient, and also see the work that the hospital has done for them for a really long time as well. So I would like to end it here, and thank you so much. So here's our website for the report of the research project. Thank you so much.
Thank you very much, Khathaleeya, for your very comprehensive and interesting presentation. So I'll now open the floor to questions. Maybe we can start with 3 questions from people in the room, and then I'll give a chance to our online participants to also ask their questions. Please introduce yourself and then, ask your questions or comments. Anyone? Yes, please.
Is there any incorrect information?
It's okay. Thank you very much, Khathaleeya. My name is Metu Razak. I'm a professor and co-director of School of Global Health at Chulalongkorn University, Faculty of Medicine. And thank you for the presentation. It's not a kind of just no corrections. Just want to point a few things out because I also had a presentation at the Chiang Mai conference, so we have already covered a lot. A few key points, and then cross-border collaboration is really important, and Thailand is playing a key role. Policy is critical. At the same time, one of the main area that we have challenges is how a few international agencies and government officials are tying the hands of the people who are practicing. Because we talk about decolonizing global health, but also we need to decolonize local health. And so when organization is working as intermediary, and then these ethnic health organizations have very difficult time sometimes, they are having to spend a lot more time reporting and collecting data for the funders. They cannot do the job. And don't get me wrong, I was a funder for 20 years as a US government. And so I understand that we need accountability. But however, how do we make sure that our support is going to the people who are intended that we want to go without increasing burden? So I think that's one area when you're talking about policy, that's one of the critical one. The other part is about drug supply and vaccine supply. So there is a systematic barrier and blockage of medicine flow. HIV, TB, malaria to an extent, and also childhood vaccine. And like you said, one of the code and healthy population is against the military. So we would like to make sure the people inside Myanmar are healthy. That's why we don't have to come to border. Nobody would like to come to border if inside is better, right? We would like to make sure that people are healthy inside. So how do we do that? But if we are not talking with the government of whoever is in the regime inside Myanmar, and then this has to be one of the priorities for Thai government, international government to discuss with the Myanmar regime. At the same time, inside Myanmar is not, when we talk about inside Myanmar, the current administration controls about 60%. 40% are with other people. So even when we talk about inside Myanmar, who are we talking with? And so this is another area that we will need to pay attention to. And the health workforce is really important. I don't want to repeat what you have said. It's really excellent presentation. I really appreciate it. But we really need to go deeper. I was a researcher, I'm a faculty, but sometimes research translate into policy and practice is not there. And so I think international community will have to make sure that the funding that we are supporting are not just going to the research and policy document, collecting dust on the shelves or in the computer, but really practice. And so, we have to work together. I'm included. I'm not just telling you what to do. That I'm trying to do it, but we are not doing well. And then I hope that all of us can do better, and for the people of Myanmar as well as for the region, because healthier Myanmar is healthier region. So thank you.
Thank you very much. Are there any more questions or comments? Okay, maybe Khathaleeya, you can respond to.
Thank you so much ค่ะจริงๆ well we received a generous comment from Dr. Methurasak since our dissemination meetings already, and we actually trying to find it, because as I mentioned that Dr. Biyasu also he's really is the main person who trying to translate our work into the policy level, and for most of the things that people at the ministerial level and all people at the parliament would hear, it's whether it's the burden for the Thailand public health as much as the people on the social media has claimed or know something like this. It's more likely to be in that direction, whether it's make sure that it's not become a burden for the financial overall, and and sometimes it's become more realizing that whether it's more like a regional health security or it's just internally national security, that's the become the most concerned part. And actually when we talking about the helping the health workforce with proposing that the licensing part would be another alternative way of doing things, but it's there's also kind of nationalistic will to really obstruct, and also the ideas of a lot of the bureaucratic and also document work that they have to get it done to be part of the workforce as well, that I was saying. Thank you.
Anyone else who would like to ask questions or make comments? Yes, please.
สวัสดีครับอาจารย์ Sumit from MSF Spain. I have a quick question. Well, based on this research, it's more on recommendations, right? Policy recommendations. So I couldn't find any point or any part in the presentation mentioned about the policy, the existing policy. So is this already included in the study? That what is the Thai national health policy towards along the border? So thank you.
I didn't put it here, but they for the Ministry of Public Health, they have the border health action plans, and also as from security agency, that they also including the health security inside the comprehensive security plan as well. But it's more likely to be about the health surveillance, not much relating to the humanitarian part of it.
Just a small follow-up questions on that, because you also mentioned about immunization, about MCH, about this war wounded care. So which is cross-border actually. So do you think Thai national health policy accommodating to those points, or is very limited only to Thai side? Thank you.
It's most likely to be initiated by the border hospital and the provincial public health level, because then they are on the ground and they know what exact situation look like. So the way that they do, they have to propose and defend their ideas that to be getting more vaccines and all, any sort of funding that they could do more work. At the same time, they're not really just simply rely on the ministerial budget come to them. They also, for example, for Mesot Hospital, they also are having a research unit that they, just like Dr. Metur has mentioned about, like they write a lot of research applicant for getting funding to get some more money to cover in this part, but it's come from the research and just collecting data all the time for this kind of research grant. Yes.
I just make a comment on that one. This is really critical because your question is very important. Immunization is critical, and for Thailand, and take a look at what's going on in the United States, and then because of the immunizations coverage is going down, and then many people are suffering, and then so that's why I don't think the Thai government alone should bear the burden, and this way, like Gavi and the Global Alliance in the kind of like a vaccine initiative, and then as well as International Vaccine Institute, and even our kind of QSMI, they can help. And then so how do we really make sure is awareness of it, and then the public awareness, and then also how do we really make sure that this is about health security, and this is about for protecting our children inside Thailand, and as well as not just vaccinations, like drug-resistant HIV, multi-drug resistant TB, and then anti-malaria resistance. Strains are coming along if we do not let the medicine going inside Myanmar, not just in the border. And this is a critical issue for us. And that's why international agencies, embassies, and international organizations and foundations can really help. But your point is really important. How do we make sure that immunization coverage is at the level so that we will have herd immunity? Otherwise, we will suffer as a region. So, but I think Thailand is doing great. The only thing is like Thailand needs a little bit more help from international communities, in my opinion. Thank you.
Anybody else who would like to ask questions? And we also want to ask the online participants to also ask their questions. Okay, maybe I'll abuse the position of moderator. I'm quite interested in your presentation, but I wonder if you can give us more data or statistics, like across the border areas. How many border hospitals do we really deal with in the case studies that you have? And then secondly, I just need to clarify when you mentioned in one of the slides, the injured soldiers. Are you referring to the Myanmar military soldiers or EAOs and the PDFs? And then the third part of my comment is, are there also international volunteer doctors and health workers working along the area, like Médecins Sans Frontières? Because I know that there are so many of them across the world, but over the years since the coup, has there been any increase in international volunteers?
Okay. Thank you so much for your questions. For the injured soldier, can I say it? As far as I know, there's are all groups that got admitted to the hospital, and the way that they deal with the hospital, they actually the payer, so mostly are the NGO, CSO that have to have agreement with the hospital that they should be able to pay the bills in order to accept to admit the the patients. Otherwise, has to be with the NGO first. But if like for the serious case, they need to go through the agreement into that part, and that's why I say that it's really informal way to do, because actually all this kind of work are the hospital has to acknowledge the political sensitive in receiving this group of people as well. But yeah, and it also depend on each location as well. For example, it's a Masot and Massareang. So mostly we went to Masot and Massareang and Chiang Mai. We see a severe case. We see the severe case in Chiang Mai that got referred to like the inner area, but mostly they would keep it at the border hospital. So we went to Masot, Tha Song Yang, also the what is called in English, but it's sub-district hospital in Massam Lab in Massareang as well, and we'll see the connection with the sub-district hospital and also the district hospital, and see how they got the systemic referral system across Saravin River, how they could cross it here and then getting inner area as well. And yeah, and each hospital has different approach to deal with this kind of case, I would say. But most of the time that they just want to get assurance that this group of patient would get covered by. But the issue with that, the funding cuts, so this streamline kind of really got stuck in the midway. And for the, I think it's because our research not really cover with the international doctors, but there's a lot of the international NGO that's already on the ground and seeing, because this group of work, they already been in the camps, but they also experiencing the funding cut. That's why they are getting more collaborate with the hospital as well. Yes, yeah.
Any more additional questions or comments? Okay. Well, so far I don't have any questions in the chat room of the Zoom so far. So
Yeah, I'm wondering because it's really challenging to me in the way that we are in like political science, social science perspective of the public health issue. So it's been quite right to see the interdisciplinary work all together, and I think it's really important to make sure that the security people also understand the public health perspective as well. Yeah.
okay, maybe one last round. Anyone else who would like to give a comment or question? Yes, please.
If no one is making it, I'm just going to give one more. And because in terms of international health workforces, and there are a lot of people who are volunteers and coming over and helping, but at the same time, some people are training a very core health workers at the very different levels. So for example, Earth Mission, and which is very kind of religious organization, is training very good surgeons and from the current states. And so there are many people like that, but it's kind of like very well funded. And they raise own money, and then kind of like they're doing well. At the same time, that the Cynthia and team are working very hard to develop backpack health workers. And in fact, I was one of the trainers from the very first backpack workers when I was at Hopkins. And then so these are the people who are working through this very closely. And I think it's really important, and then that we recognize them. And then also, no matter what, international people will be here temporarily. And so what we need is the homegrown local health workforces, both from Thailand as well as from the many ethnic groups of Myanmar, to work together. And that's where the sustainability will be there. And without it, and if expecting some temporary people to parachuting and coming over, and it will not work, because like this region will continue being somewhat of a conflict, and that would be we need to maintain that one. And also in terms of like sectoral, multidisciplinary, collaboration is really, really critical. Without political science and without economics and without the kind of social science and without people in defense, security forces, and we cannot help the region. And so for me and also if soldiers are not healthy, if our police forces are not healthy and immigration are not healthy, and we cannot have the good workforce for Thailand. And so the reason that we are talking about drug resistant, antimicrobial resistant strains to not coming to Thailand, by making sure that we have medicine available for more people inside Myanmar, is also making sure that our police, our soldiers, our immigration officers, our doctors, our teachers, and our workers are healthy here. And so I think that's why political science, economics, as well as the communications, in the faculty of communications, if we can work together, it'll be really wonderful. So I really applaud the political science and Nelson Mandela Center for taking it on. And then we would love to just make sure that we keep working with you. So thank you.
Thank you very much. Well, there's at least a follow-up question from Zoom. I don't know if you would like to respond to that question. What do you think about the news today about global perception of Thailand in the view of humanitarian health assistance?
Not sure about the news. Is there any news you would like to share it with me? I think in terms of the global perception of Thailand, for me, about the public health system, to me, it's really well known to, all the world. We are top 5 in doing universal healthcare coverage. But at the same time, as I mentioned, the healthcare coverage are not covered on Thai. That's the issue that we can work further in that part as well. I would say in this way. Thank you. Yeah.
Okay, I guess we don't have any more follow-up questions or comments at the moment. So I'd like to thank Khathaleeya for her very comprehensive presentation. I think it's very important to really think about the health dimension as far as the Thai-Myanmar border security issue is concerned, which is not very much covered, in the news. And I'd like to just say that we are looking forward if there's additional follow-up, research on this one. So let's all give our appreciation to Khathaleeya to her presentation. Thank you very much.